All right, good evening. Tonight's chapter 30, abdominal and genitourinary androids. So we'll get this situated. Look, do me a favor, folks. I know a couple of you have messaged me back and forth. Please take a screenshot, whatever so else y'all can that y'all need of the the code at the end because it doesn't change. That is the same code that you will use for your test and it's for your attendance. I hope y'all realize that by now. But a couple of you guys have just accidentally not written it down correct or not paid attention. That's the reason why I say it a couple of times and I leave it on the screen for a hot minute. So if you can take a screenshot of it, that'd be awesome, and we'll keep moving on. If my computer will act right. All right, so trauma. It's one of our another learning.
Hey Chris,
Yo,
hey, this Alex.
what's up?
What's up, man? Hey, I sort of like left my computer at my other station, so I didn't do it. I might have enough time to finish it at before 12 tonight,
Yeah.
or it's 12.
No, you get 5 days. The test is open for 5 days. You have
Okay,
5 days to take your test before it gets locked. So as
okay.
8 o'clock tonight, your test will be unlocked and it'll be open for 5 days. So that's
I'm
where
talking about chapter 29.
uh, it should be open until midnight tonight. I think that's what I told you.
Okay, okay. I was just trying to make sure because I left my computer at another station.
Yeah, yeah. We can put you a little tag on that thing. Seems like you keep leaving that thing. All right. So trauma applies the fundamental knowledge to provide basic emergency care and transportation based on assessment findings for actual injured patients. So, we're gonna have fun talking about this and abdominal and personal trauma. So, I'll make sure I get everybody situated. All right. So I want you to recognize the management, blunt versus penetrating mechanisms, visceration or impaled objects. We'll talk about solid and hollow organs. Again, blunt versus evisceration, injuries to the genitalia, vaginal bleeding due to trauma, and sexual assault. Kind of touched a little bit of that on one of the other pictures, or the other chapters, but obviously we're gonna hit it again. Um, what I want you to do is understand of the functions of the organs, so you can assess the seriousness of the injuries. So I want you to get an idea of what's going on, how to do a pelvic exam. Obviously, we're not going to check for pelvic cavity injuries, but if we have to look, we have to look, but we're not going to palpate a cavity. That's if y'all understand what I'm trying to say there. We'll talk about the significant trauma, the abdomen, can occur from blunt injuries. We talked about previously how much blood can be held in the abdominal cavity, so we know that somebody can bleed out when there's an issue. 10% of all trauma patients have some sort of genitalia injuries, so they're just as important. I mean, I think all of us are proud for what we have, so we don't want nothing to happen to it. Here we're going to go back over again of the quadrants, how to dissect which one is in what quadrant. Need to kind of have an idea. Y'all can see right here of which organ is in what quadrant. It's very good to know those, especially when you start palpating those injuries and to see if, hey, there's something wrong there. Well, this is why it's wrong. This is the reasoning of their pain. So keep that in mind when you're going through this. And uh, when you look at this next chart right there, on which quadrant is where. Now, this goes off the patient's side, right? You always orientate yourself with the patient's side. So if it's patient's hurting on the patient's right, it's always referred to as the right. Because if I'm looking at them face to face, that's going to be their left. So no matter what, you always go off the patient's side. In here, we're talking about the right upper quadrant. See how it goes around the diaphragm. Your right and left upper quadrants. Your right and left lower quadrants are all separated. But you again here, look at the organs that are involved. Those are very good, like I said, hint, very good on what organs are where, because you might see that again. All right, so we'll talk about hollow organs. So we have in the abdominal cavity, we have several hollow organs. The hollow organs of the abdomen include the stomach, the intestines, the uterus, and the bladder. You want me to say that again? So it's the stomach, intestines, urine, ureters, and the bladder. Most of these organs contain food that is in the process of being digested, urine that is being passed through the bladder for release of bile, and when ruptured or lacerated, the contents spill into the peritoneal cavity. So you know that you have feces or food within the cavity. So that's the reason why if there's ever an injury there, they always want to open you up and flush you out. It's just to keep from infection happening, and the faster that they can get you healed, the better off you are. The peritoneum is an inflammation of the type of this type. I'm sorry. They can cause intestine and inflammation reaction and possible infection. Peritonitis is one of those infections. Uh, it is serious and will become life-threatening if not fixed. And signs include severe abdominal pain, tenderness, and muscular spasms when you start to have these problems. All right, so here's our hollow organs. Go over this part. Patients with injuries to the mesentery can bleed significantly into the peritoneal cavity. Signs of this include abdominal rigidity and premiumbilical. Stand by, y'all. 1 second. All right. Signs of abdominal rigidity and premiumbilical bruising. So that if there's any injuries there, you'll notice those signs and symptoms there. An intestinal blood supply coming from the mesentery, which is a fold of tissue that connects the small intestines to the abdominal wall. So, oops, stand by, wrong mouse. So look right here. So anyway, the little small skin we were talking about is what holds the small intestines in place. Now it's not going to be sutured to the body or nothing like that, but it just keeps them from all moving around up and down and all that. Everybody knows your gallbladder. This is your bile duct. Some people may or may not have gallbladders anymore. Um, they really not needed. They just get in the way, but hurt really bad when they messed up. Large intestines, small intestines. Your fallopian tubes are on each side, which we went over in different chapters. Your appendix is right down here. You can lose a crap ton of blood in your appendix if appendix ruptures. Uretus and urinary bladder. Um, your ovaries on the side. Everybody in this class should know that. Then you talk about your liver, your adrenal gland, your kidney, your ovaries, and my screen won't allow me. Then you'll talk about your spleen, adrenal gland, pancreas, and your kidneys. Kidneys, we all abuse them at some time in our life, one form of fashion. We all grown adults, so at some point in time you've abused them and tried to keep them going, but they are very much needed in our day-to-day life. Um, so the solid organs of the abdominal include the liver, spleen, pancreas, and kidneys. Uh, these organs perform chemical works of the body, and this is important. Enzyme productions, blood cleansing, and energy production. The reason why those are so important is because we gotta have all of those, every single one of them, to make day-to-day life. Sorry, hang on. All right, because of the rich blood supply, hemorrhage of solid organs can be severe. So if it's a laceration, a cut, or anything like that, we're going to bleed out pretty rapid because they so high in blood. I don't remember exact words on which one carries how much amount of blood, but it'll blow your mind on exactly how much they carry. All right, there we go. They're back. The yawns are here. If you have injuries to the abdominal, injuries are considered either open or closed. Are going to have solid and hollow organs, as always. So some blunt trauma to the abdominal will cause deep bruising. Uh, Here's some of your MOIs: steering wheel, bicycle handles, motorcycle collisions. I'm pretty sure it's not a collision. That's going to be a wreck. When you hit that bike, it's going to be a wreck. And then slip, trips, and falls. If you'll look right here, you will see some bruising. Does anybody want to take a guess what that's from? You can type it. I don't really expect some of y'all to talk. All right, so we're going to be from a seatbelt. Typically caused by poorly placed lap belt. Blah, 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 blah. Creates an injury pattern called a clasp knife injury. It can also be caused when a person is run or rolled over by vehicles or objects. You can see where potentially the tire could be right in through here. There's a roll there. Person or the vehicle that he or she is traveling in strikes a large immovable mass, such as a larger vehicle, a bridge, or the ground. I'm gonna say a tree too, because we can't just move trees all around. They talking crazy like it ain't gonna be a tree. Signs and symptoms. You can have a lot of pain, but the problem is the pain is not gonna be. It can be a referred pain. So if my left shoulder is hurting, it can also be related to a gallbladder pain. Chest pain will be masked just like gallbladder injuries. Uh, so I lost my train of thought there. All right, so liver and spleen injuries refer to pain to the shoulder. See, that's a referred pain. Tearing pain from the abdomen posteriorly may be a dissected aneurysm. We talked about there in the cardiac chapter. Pain following the angle from the lateral hip to the midline of the groin can be the result of a damage to the kidney or the ureters. Pain located in the right lower quadrant can indicate an inflamed or a ruptured appendix. Pain under the margin of the ribs on the right side or between the shoulder blades can indicate injury to the gallbladder. These are all referred pains, as we know we're used to having. Blood or fluid in the peritoneal cavity produces acute pain to the entire abdomen. So that's kind of a telltale. You kind of gonna know if they're having pains there, it's gonna be the entire abdomen is gonna be our problem. Now, granted, we don't want to see that because it's gonna be a lot of pain. We're gonna have trouble trying to get that situated because we really can't fix mass abdominal injuries. Pain spreads as the blood or contaminants seek out of the voids in the peritoneal. Often a jarring motion, rebounding tenderness, or Bloomberg signs will alert the patient to the peritoneus or inflammation of the peritoneum. Now, somebody, the five of y'all, look up what Bloomberg sign is. Blumberg. Bloomberg signs. I'm gonna patiently wait for y'all to get that done, but we're gonna keep going. All right, some signs that are continued.
It's referred to as rebound tenderness.
Oh, Jesus, she's alive.
Hey, hush, I told you what's wrong.
I know, I'm messing with you. All right, so determining the location of the pain or referred pain can be difficult because they're gonna guard the pain, which means I don't want you to touch it. I don't want to stay away from my stomach. Please don't press on it. So they're guarding the injury. All right. Conscious or unintentional stiffening. Oh, sorry. Okay. Con- Conscious or unintentional stiffening of the muscles of the surface of the abdomen to avoid further pain. So what they're saying is you are trying to stiffen the pains to keep you, when you feel it, it feels like muscles. So instead of you poking around on their stomach, they're trying to tighten their stomach up and quit you poking on there. So this may also be mistaken for abdominal rigidity. Abdominal distension or swelling between the xiphoid process and the groin is often a result of free fluid. I'm not real sure what free fluid is, but as blood or organ content spilled into the peritoneal cavity. I don't like free fluid. I want to keep that in its right spot. So some additional signs of abdominal injuries are bruising and discoloration. We showed some pictures about that the other day when I sent the chest for chest injuries. Closed abdominal injuries may be initially as abrasions, and then eventually you'll have some deep bruising because of the blood pooling or in the proper process where it's not supposed to be, and then you got to deal with all the discolorations. Seat belts. I'm gonna go ahead and skip to this. So we know seat belts are supposed to be done in certain ways, worn, carried, figured. They all have certain ways to do things. Well, a lot of times we don't put them there, and they in the wrong place. So these are all incorrect, and this one is correct. Not really much difference, but depends on your height sitting in the seat. You have it adjusted correctly. So that's where you're going to see all these different positions come in play. Now, not many of us wear it so far down. A lot of us do wear it across our chest, which is incorrectly. But that's what Jones and Bartlett 2017 is telling us is wrong. We'll go off of that. All right, so foreign objects. Whew. The best thing you can do on foreign objects is don't pull them out. Leave them in place, stabilize, and then let somebody of higher abilities pull that out once they're into surgeries. Injuries in which the foreign object enters the abdomen and opens the peritoneal cavity to the outside. So now it's introduced into the funk that lives outside the body. We don't want the funk into the wound. A stab wound or gunshot wounds are pretty much clear examples of that. Some open wounds can be deceiving. Therefore, you need to maintain a high index suspicion of an unseen injury. You know you're going to have internal damage to the organs, to the skin parts, and it's possibly going to be life-threatening. So, depends on your assessment and your care on what it's going to be. Now we'll talk about the velocity of an object can help predict the amount of the tissue damage. This is where I like to normally talk about guns and the powers and to be and da-da-da-da and all that fun stuff. But some of you may get bored by that, so I'd say if you'd like to, I'd be more than happy to carry that offline. So a low velocity is caused by handheld or a hand-powered object such as knife and other edged weapons. So if I stab you with a screwdriver, they're going to consider that a low velocity. So medium velocities are smaller caliber handguns. Now, I wish I could tell you what smaller caliber they're talking about, because with the increased velocity and the FPS that are allowed into the guns, your 9mm and some rounds aren't considered a medium velocity. But 380, 22, 32, all those low calibers are going to be considered a medium velocity. Now, if we step up into a high velocity, they're going to talk about rifles of any kind and handguns. Again, it doesn't tell me much information when they want me to discuss about the high-powered, but normally you go anything over a 40 caliber, 40, 45, 50, 5.7, anything like that in a handgun, and then when you turn it into any particular rifle, shotgun, all that's going to be considered a high velocity injury. So all your high, medium, and low velocities have a temporary wound channels. They have a shock wave. They have all these things that you have to think about that are going to affect the way that this bullet's introduced into the cavity. Oh, I'm so sorry. A cavity forms as a pressure wave from the projectile is transferred to the tissue. So imagine a shock wave that this bullet is creating that is pushing through, and now the organs are going to have microscopic tears in all the blood vessels. It can produce a large, no, it's going to produce a large amount of bleeding. I don't care if it's a 22. I've seen many people die because of bleeding from a 22. Can produce the higher velocity of the projectile, the larger cavity it produces. So let's say you take a lead pencil. No, let's just do this. So take a mechanical pencil. Y'all can all imagine in your head the size of the lead that's in that mechanical pencil. Now I'm going to take a Sharpie, and that's going to be a high velocity injury if we're talking about bullet size. So you can imagine how much damage the little clicky pencil is going to be versus the Sharpie that's going to be that much bigger. So you think about how much fluid can come out of either one hole. Well, obviously the bigger the hole, the bigger the bleed. So we're going to talk about, oh, wait, stand by. Did I even click that? No, there we go. All right, so low velocities, they also have the capacity to damage organs. Internal injury may not be apparent during physical exam because it may appear to be an entry but no exit because it closed itself, and the bleeding is gonna hide the fact that the object went further and deeper into the peritoneal cavity than what you can originally find. At any time a patient has an injury at or below the xiphoid process, you should assume that the thoracic and peritoneal cavities have been involved. It's easier for us to think the worst and let them at the hospital figure out the rest. It's not our problem to dig deeper in the field. I don't want to stick my hands in your stomach to be like, I think it stops right there. It didn't go through. It's not my job. I don't get paid for that. I think I'm smart, but I'm not that smart. All right, so eviscerations. Whew, these are gross. I don't know if y'all have ever seen them. So this is where the bowels protrude from the peritoneum. Yeah, just y'all can imagine that. If you don't know what I'm talking about, just Google it. It's gross. Uh, when it happens, these people are going to be doubled over in pain. It's not something that is just, oh, look at here. Da, 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 da. No, it's very painful. Do not push down on the patient's abdomen because that's where it's supposed to be. So don't push down on it. Leave it alone. Only perform a visual assessment. Um, cut the clothing close to the wound. You want to open that area up. And never pull on any clothing stuck in the wound. Just leave it. Just leave it. That's the easiest thing that we can do is just, Jesus, just carry on. Go on with them. All right, signs and symptoms. Patients with abdominal injuries complain of a common sign of significant abdominal injury is tachycardia, because you got to think they just had a lot of shit happen to them, and now they trying to figure out what to do. So their blood pressure is going to be up. All their vitals are going to be elevated because of this significant injury. So the heart's increasing the pump and the pumping action to compensate for the blood loss. So what you think? We're going to deal with tachycardia? You're right, we are. So now we got that issue to fight with too. You may be having signs of shock soon. And then you're going to have a decreased blood pressure. You're going to be pale, cool, moist, and it's just going to look like crap. And the patient's mental status is, it's not going to naturally happen as soon as possible, but over time you're going to notice a mental change because of the blood loss. So an abdomen may be becoming distended from all the blood that's swelling in the belly. When it's all pushed up, the belly gonna get stiff. They're gonna look like they ate a watermelon whole. Some of your blunt injuries need to move your attention to some of the underlying structures. You're gonna have just as much injuries there. Bruises to the right upper quadrant, probably gonna have issues to the spleen. The left upper quadrant, I'm sorry, let's hang on. I swear I'm dyslexic. If it's going to be the right upper quadrant, it's going to be issues to the liver. The left upper quadrant is the spleen, and bruises to the flank. So that's going to be your back. May suggest an injury to the kidneys. So all of those are pretty serious. We don't want to ever see signs like that. But over time through your career, you're going to run across that. You're going to see those injuries and those illnesses, and it'll help you if you kind of understand the quadrants on how to deal with them. That's the reason why I was kind of kept tapping on the wall and knocking back and forth, because that's what you need. You need to have that. You need to have the knowledge of what's going on to help treat them. Some bruises around the belly button. It's called the Cullen sign. Cullen''S. Y'all look that one up too. Y'all ready? Cullen''S. And that's a telltale sign that they're gonna have an abdominal injury, and it's gonna be bleeding because now it's tender. It hurts to push on it. It hurts to kind of give any kind of feedback. Be like, whoa, 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 that's tender, bro. What you doing? They may not be as nice. All right. So some hollow organs. Um, let's see. There's delayed signs and symptoms. Every hollow organs are commonly spill the contents into the abdomen. The infection develops, which takes several hours or days, so they may become septic while they're in the hospital as they're getting treated. Maybe the entire stomach didn't get washed out, and that's what's left. Stomach and intestines can leak highly toxic and acidic. Yeah, because you remember you're busting the stomach contents out and putting it in a cavity that's always been clean throughout this entire time until something popped it. So it's highly important to realize whatever goes in there has got to come out. It needs to come out the best way possible. Blunt penetrating causes hollow organs. Blunt trauma causes the organ to pop, releasing fluids and air, maybe like the lungs, parts of the intestines. That's really what's happening there. The gallbladder and the urinary bladder. Think about all the bile and urine that's coming out of there. Air in the peritoneal cavity causes pain because where's it supposed to be? Not there. It's supposed to be in the lungs. Then you're filling up pleural space with something that normally doesn't go there, so everything gets tight and it's uncomfortable. Solid organs can be significantly and cause rapid blood loss. Whew. It's nasty. They can be hard to identify because you can't see them. You can't touch them. You're just going off. You're like, well, I think that's where his liver is. If you're not pretty strong on the anatomy of the body. Solid organs can also slowly ooze blood into the peritoneal cavity, causing pain to increase slowly over time because now there's not much room for all the blood. So the more blood that's leaked out into the cavity, the less empty space there is. So it shouldn't feel comfortable. That's not what it's supposed to be. It's going to be, you may not know what's going on as a patient or a provider. You just know they're saying that their pain is increased. So, and that's the reason why it's hard is also as a medic, we can't give them pain medicine because you can't mask the pain because all it's going to do is make it worse. Because once they get to the facility, they can't properly treat them. All right. So the liver is the largest. The liver is the largest organ in the abdomen. I hope y'all can hear me knocking. If not, I'm just gonna sound like a fool. It's very vascular and can contribute to a hyperfusion if injured. A common finding during assessment of the patient with an injured liver is referred pain to the right shoulder. They're always like, man, my shoulder hurts. Oh my God. It hurts to move. It's just painful. Now you know why. All right, so the spleen and the pancreas are very, very vascular. Both are very prone to heavy bleeding when fractured, lacerated, or punctured. Uh, the spleen is often injured from MVCs, steering wheel trauma, falls from heights, bicycle impacts, going over the handlebars, ATVs too. Don't forget about that. Just because it says bikes, think about anything else that has steering wheels, snowmobiles that we probably the ones from us in the South don't ever know what they really look like. We just see them. Um, your diaphragm. Can y'all remember which see what keeps the diaphragm alive? I'll take that in the chat. Um, if the diaphragm is penetrated or ruptured, loops of bowels may herniate into the thoracic cavity. Whew, because y'all got to think there's so much pressure inside the abdominal cavity that any little boop of rupture is going to allow that to move. Um, again, I take everything back to kind of the hunting. If anybody's ever hunted and had to skin a deer, you understand that process if you've seen it done. And as soon as you open the gut, you get this rupture, just loud smell of just whoa, wretched crap. And you don't ever want to rupture the stomach. You always want to try to keep that closed and contents together. But there's a pressure, so if you do pop it, you're going to see an internal organ come out. I promise you. It's going to happen. That's when you take the knife from the other person and start skinning yourself because it's gross. Period. I promise you. Kidneys, damage to the kidneys, you're going to have a lot of blood flow. If you pee blood, you have a hematuria. That's what they'll see when that's the reason why they check your blood. I actually just opened up, when we do urine test out here, not for drug test, we test for blood, and also um, you can have negative all the way up to large amounts. It shows up on our dipstick, not what y'all thinking, but we can tell exactly how much blood you potentially have in there, and then for how long. We can tell how you're hydrated. We can tell all sorts of stuff by your urine and using just a regular dipstick. Blood visible on inspection of the urine. Urinary meatus indicates significant trauma to the genitourinary system. I don't even know if I'm saying that word right. Genitourinary. You might want to pronounce that for me. Maybe I can figure it out. Y'all quiet tonight. Um, assessment of abdominal injuries is one of the most difficult to assess that you will perform because you can't see it, folks. Just because there's a belly there and you're like, there's a belly. I don't know what you want me to do. People are always going to be in pain there. Their pain scale is going to be like, oh, it's automatically a 10. I hadn't asked you that yet. They're always going to have severe pain. It's going to be super painful. They not going to be the nicest in the world. Um, patients may be overwhelmed with other more than painful injuries. Some abdominal injuries develop and worsen over time, making the assessment critical. That's why you have to stay on top of things and realize, is this really what I see here, or is it a masked or referred pain of something else that's going on? That may be a hint for you. You're seeing size up. We know this. I'm gonna skip this because we know it. Um, all right, here. So closed abdominal injuries. We don't really know how bad that injury is. That's one of those that is just you're only going off of what the patient tells you, what the MOI is, and you just kind of like, I guess this is right. I don't know. You see, you see what you get, and you got to kind of make up with it. You got to kind of make up on the fly what potentially can be wrong. The patient requires rapid transport because You can't see it, and you know this person just got crap knocked out of them, and they're complaining of abdominal injuries, and it could be a broken pelvic. They could have ruptured something. They've ruptured their spleen. Boom, there you go. There's a lot of blood on the ground. Position the patient in comfort. You may have to put them in the left lateral recumbent position, the recovery position, which is it's everybody, that's all been picked up since pregnancy. Majority of the pregnant women need to be placed on their left side, which is perfectly fine because their organs work better on the left-hand side of being there. That's why we put everybody on the left-hand side. And plus, in the ambulance, in the back of the ambulance, we're automatically looking at them when you get them put on their left side. You put them on the right side, they're going to turn around and be facing the wall. So I don't need that. I need to be able to see them. Again, I've told y'all multiple times, don't stop providing oxygen. Give them, it's cheap. We know that. I've said that 100 times. Give them oxygen. If you think they're in shock, treat for shock. So patients with the blunt abdominal wounds may have all the ones there. I'll let y'all read that real quick while I take a drink. The biggest one that I see there is your tears and your ruptures, lacerations. I mean, all of those are very serious. By no means I'm kind of downplay one versus the other, but ultimately you want to look for the ruptures, tears, and the lacerations. To me, we're not going to be able to see them. We're just going to go off what signs and symptoms we get from them, what they tell us. And no, you can't be like, hey, bro, I know you in some pain now, but quit bullshitting me. Let me hear what's really wrong. You can't do that. You take it for what it is. If they say their pain's a 10 out of 10, it's a 10 out of 10. That's what you're going to treat them for. Best thing we can do is protect their spinal cord. We're going to monitor the vital signs. If they're critical, everybody knows, I hope you do, we're going to do a Q5, which means every 10 minutes, 5 minutes, blah. And if they're non-critical, but if you know that they're facing abdominal injuries, we need to treat that as a critical patient. Open abdominal injuries, be very cautious with this. Don't just be like, what's up in there? Start looking for stuff. Even if they have passed, it's not the time to treat them as a training dummy. Always be serious and looking for some unseen blood loss. You may notice from the time you start to the time you finish that their attitude has changed. Their overall demeanor that can give you signs saying that they've lost a lot of blood. If it is penetrating and it is still there, transport them with the object in place. Don't try to remove it because you're going to create more damage. That's going to be bad for you. Cover the injury with a moist, sterile dressing. Make sure when you do that the internals don't dry out. You want to keep them wet and moist with a dressing. So that's the best thing that you can do there. Some open abdominal injuries, check their back. In case something has exited, you want to check that. Apply well. This one's saying apply dry, sterile dressings to all open wounds. I've always put a damp dressing on there because you don't want things to dry out. That's what I was taught. But I'm telling you here that it's saying apply a dry, sterile dressing and let them take care of that at the facility. If the penetrating object is still in place, apply a stabilizing bandage around and control external bleeding and minimize movement. Try to keep it as still as possible. There's a couple of skills that I wish that I was going to be at the boot camp for to show you guys how to stabilize certain things. And I've learned that just over time. It's not that that's a testable skill. It's a in the field learning experience. but I would like to share those with you. I'm sure Rob knows them too, and I'm going to pass it on. I mean, Rob's a very, very, very smart gentleman. So y'all can see I said that on recording too, huh? Nah. So evisceration. Bloop. I've taken care of 2 of these in my career. One lady had a C-section, going home with her baby. She sneezed on the way home and boop, popped out the incision. So this is the internal organs just poke through a wound, just bloop, and they're out. That's basically to say what an evisceration is. It's not dangerous, it's not critical, it's not life-threatening, but they need to go back to a medical facility to have them put back in and to be treated. Never, I told you there, never replace the protruding organ. Keep the organs moist and warm. You want to cover with a moistened sterile dressing. Secure it with a bandage if possible. It depends if you poured water on there. Now you ain't gonna get nothing stick. And tape it. You want to try to keep them as safe as possible because now that's an open entry to the body that we need to protect. We need to make sure uh, that nothing else is gonna get in there. So here's a little cute little picture for y'all on how to take care of things. The evisceration's there, clean them up, get it situated. I'm assuming here they just didn't clean the blood up. That's what it doesn't appear to be like it's still leaking. Yes, the pool is bigger than the rest of the pictures, but I'm pretty sure that they cleaned it up and tried to apply the dressing there, and that's what it appears to me, and that's what I'm going to guess like. Anatomy of the genitourinary system. We know what these are. The males lie outside. The females lie within the pelvic cavity. They're protected. Organs are all of this system are located within the abdomen. Whoop, I don't know what I just clicked. Sorry about that. We will have the front view, the side view of the male uh, anatomy system. We'll go report that. I mean, us being grown folks, we all should know what these parts are, where they are. Um, So just so y'all can get some orientation, the pubic bone for men, we have the prostate glands back in here, the urethra, the testes, which I say that these are kind of like the ovaries for women. They're just located different. But thank God we don't deal with the same things that some of the women deal with. Whew. Your prostate glands right in here. Just kind of y'all can have some ground level, kind of some idea where things are. We know about that. Here's the bladder. I always say some people's bladders are bigger than others. You always know, like the little kids seem like they hold 5 gallons. The older you get, you can't even hold 2 ounces. Hey guys, y'all take just about 10 minutes and let me handle something real quick. Hey, sorry about that. So that was a quick little break. Honestly, we ain't got that many slides left because I skipped a whole bunch anyway. So I'm sorry about that. I know y'all are upset. Maybe I lied. Maybe we have quite a few more. Let me get back to the. All right. So we'll go here, click, next, do something. So now we talk about the female reproductive system. Here's our pubic bone right here. We have our labia. We'll have our bladder, which is right in here, which is all the time full when you try to get in the car and travel. No, I'm just picking. So your cervix, we know where your uterus is. So you can kind of see here's the ovaries, same kind of the reproductive as a man, but definitely a lot more complicated. Um, so kidney injuries, so the kidneys are protected pretty tight. I mean, they up in there. They so it's less significant injuries can result from indirect bowel or even a football tackle. Sorry, force indirect blow. I'm trying to read multiple things at one time so I can give you some more information. So you may have an indirect blow or even a football tackle can bruise your kidneys or injure your kidneys. So it's not real hard to injure them, even though they're protected pretty well. Um, if you suspect a patient with a kidney injury, hey, y'all, give me just another minute. All right, sorry about that. Multiple patients coming in tonight. They require some attention. So y'all have read that. We'll skip that section. I know that y'all had plenty of time to read it now. Wherever this will work. All right. So if you have any injuries to the bladder, you like that? Just know that you're gonna have urine that's gonna come out. The urine here, look right here. There's a good picture. So anywhere right up in here, if you have part of the pelvic breaks and it punctures the bladder, you're gonna have a, a void where all the urine comes out. Sometimes I have seen where the urine, the bladder has been ruptured and deflated, and this is just they have to, flush and flush and flush out the entire cavity to clean it out because they don't want any other injuries. They don't want infection or to leave any around. Yeah, the body will absorb it over time, but it's easier if they can wash it and flush the body out. So it's some external genitalia, male genital injuries, soft tissue wounds. It's going to be a great deal of pain. You let me tell this story. I'm going to say it's a great deal of pain, ladies. Y'all know about that. You can tell me. I'm telling a story. Y'all can tell the pregnancy stories. So if a guy says that this is such and such happened to his genitalia or his privates, give the guy some respect and just say, yes, it hurts the worst that it can. I understand. You let us have the man flu and we're going to be good. Don't give the genitalia injury any more importance of an injury over something else. If you remember the rule of nines, it's 1%. So let's just think about that. So if there's a multi-system trauma and their genitalia is affected, it basically is not going to cause death. To me, it's going to be death. It's detrimental to my life. You fix that pain. But as we can see and be more realistic, it's a 1% on the burn scale. So it's not going to kill you. There's a reason why it's 1%. No jokes, no pun intended. Y'all be quiet. All right, so the female genitalia injuries, you have the uterus, the ovaries, fallopian tubes are rarely damaged, but there's always that one chance. Sherry, don't you let me tell the story. I told y'all, let me say it. So the only exception to this is if they're pregnant, expect a high possibility of injuries. Sometimes the uterus can enlarge and rise out of the pelvic. I don't really know what that's called, but that sounds really, really painful. If they are pregnant, keep in mind the fetus. In the last trimester of pregnancy, the uterus is so large and it may obstruct the vena cava. The blood pressure may decrease because of that, and the patient should be placed on her left side so the uterus will not lie on the vena cava. And if y'all remember, the vena cava is a very large flow of blood, so that's why we need them to keep that blood, keep it flowing, also protect the fetus. Some of the external female genitalia, uvula, clitoris, major and minor labia, they are very, very rich in blood. It's just like the facial injury. They're going to bleed a lot. So ponder that and remember that when they talk about them. Consider a sexual assault or pregnancy. If you suspect a external bleeding, use a sterile absorbent sanitary pad. It may be applied to the labia. Do not insert anything at all whatsoever into the vagina. That's not where it needs to be done. This information is relevant because some medications and tests are harmful to the fetus, so be careful on what you apply and put. Anybody of childbearing age is pregnant until proven otherwise by a test at a medical facility. So that is, I always tell everybody, are you possibility you'll be pregnant? Nope. Have you had your ovaries removed? Nope. Then there is always a chance that you could be pregnant. Period. Potential for patient embarrassment. Be respectful, y'all. Don't make sure. Just be like, oh look, you're bleeding from your privates. You just don't want to tell everybody that. Um, Look for blood on the patient's undergarments and only inspect the external genitalia when there are complaints of pain or external signs of injury. You must have consent. Let me make sure that again. You must have consent to do this, otherwise, that is sexual assault. That is on you. You will go to jail. You will lose your license and you will never get it back. I want to make sure y'all understand that before we move on. Scene size up. Look for the injuries. We know it's the same thing in every group. Talk about primary assessments. Quickly assess. If you suspect a lot of bleeding, make sure you secure it, pat it, clean it, keep it protected. Look for general impression. Obviously, airway and breathing. Circulation. Don't check for a pulse, people. It's not going to have one. Just keep your hands away from it so that you'll keep your job. Closed injuries do not have visible signs of bleeding. Be cautious. Transport decisions. They're not saying they have to go to a trauma facility, but they need to go to an appropriate facility that can treat them and potentially do some surgery that is going to be at a surgery care center. So remember that may be needed in the proper place. If they have nausea, vomiting, diarrhea, blood in the urine, vomiting blood, I was going to say if we started out with nausea and vomiting and diarrhea, we're going to go with COVID symptoms first off. The reason why is because if everybody's ever had any kick, punch, accidental hit to the private, you'll understand where all of the nausea and vomiting comes from. I'm not really sure diarrhea unless they're talking about passing of blood, but you can imagine if you're hit hard enough, you're going to have blood. If you have a hard enough trauma, you are going to see a lot of these other parts in here. So they're just going to tell you all of them in the beginning. Sample history, OPQRST, we've multiplied many of that. I will be sending out I don't know, I'm gonna send y'all some homework that I'm gonna post out there in a little while, so y'all just know that that's coming. I'll provide some directions on that after this chapter. Physical examinations, privacy is a must. Remember that's somebody's family member, that's somebody's father, mother, daughter, son. Respect them. Assess for DCAP BTLS on any injury we come across, which we know that. We've talked about that multiple times. Physical assessment, start with a full body assessment, head to toe. If you find some significant bleeding, fix it and keep it right there. If it is a life-threatening injury, do your best to fix it right there. Stop, address it, and move on. Lacerations and swelling, they're okay, they'll be fine. Vital signs, obtain your vital signs Q5, move on. Interventions, if you do an intervention, note, has this improved? Does this make this any better? What does it make it any worse? Document what you have done. Communicate your procedures to the medical facility that this is what you found, this is what you did. It did improve it, or it made it worse, and you didn't do it again. Kidney injuries, they're not always going to be obvious because you're not going to be on an EMS and be like, hey, can you pee in the cup for me? So remember that. That's just something that you're going to have to go off of a suspected injury. I'm not really sure how you're going to see blood to your urethral opening. Signs of trauma to the lower abdomen, pelvis, or perineum. Transport, it's the best thing I do. Transport rapidly. It's the best thing I can tell you. External male genitalia. If it's enough damage, trauma to that, try to put them in the best comfort, make them feel comfortable. Use Sterilmost compress over the cover area. Strip to the skin. Applies direct pressure with gentle, dry, sterile gauze. They can do that too. Make them hold it. They'll know how much pressure you need to put on there and not. Never move or manipulate foreign objects in the urethra. Let somebody else gets paid a whole lot more money do that. I promise you, it'll turn out better. Identify and take avulse parts to the bag of the hospital. It's just like with a amputation. Ice it, take it with you. At some point in time, somebody's career, they can say, I've reattached X times. Control your blood loss. Try to, you ain't gonna put a tourniquet on this. Y'all know that. Come on now. But manage the blood flow. If there's a substantial amount of blood, let's fix it. Let's stop it. It shows right there, surgical reconstruction is possible if you're able to locate the amputation. That's probably the easiest way to put it. I was going to try to say something funny, but it really wasn't. If connective tissue around the surrounding erectile tissues is damaged, shaft may be fractured or angled. I don't really tell you about that one. Never seen it, so I have no experience in that. Injury may occur acquired during active sexual intercourse, associated with intense pain, bleeding, and fear. Oh, oh, I can imagine. I can imagine. It's a lot of fear. This one's getting me. Laceration to the head of the penis. Local pressure with sterile dressing usually stops the hemorrhaging. Skin of the shaft is going to be caught in the zipper. It's not uncommon. If a small segment of the zipper is involved, you can try to unzip the pants. If a longer segment is involved, usually use heavy scissors to cut the zipper out of the pants to make the patient more comfortable. And be very, very clear to this patient what you're going to be cutting. You want to do your best abilities too, not to damage the scrotum while cutting. I don't know why they made us be very descriptive in that. That seems to be very common, and I know some things are not simply understood in life anymore, but we have to tell you folks that. Some urethra injuries are not uncommon. Save any urination for later examination of the hospital. I'm not transporting urine to the hospital, I can promise you. Not unless it's in a Foley or something that's attached to this person. That's on them to get. Any foreign bodies protruding from the urethra may have to be surgically removed because Chris Wally ain't going to touch it. We're just going to transport it, cover it, and go from there. I wish I could tell you. Recently, I had a patient out here the other day that got airlifted, but it all dealt with this chapter. That's the reason why I laugh, because that was the initial part came in as chest pains, and it dealt with later on being penis issues. I don't know. I don't get it either, but it is what it is. It's still kind of funny out here. If there's damage to the scrotal area, you can use an ice pack. Now, just remember it's going to be super cold, so you may have to wrap it and provide that layer of protection before you apply direct pressure, of ice to it, because you don't want it to mess it up. Oh, sorry, that's exactly where I was at. Y'all were on a different screen. So now we're going to talk about the vagina. If there's anything here, don't pack it to dressing. If it's bleeding, just pat it and allow the female, if she's conscious enough, to hold the dressing in place, apply enough pressure to control bleeding. Leave all foreign body. It doesn't matter where you're at. Unless it's impeding in the airway, don't remove anything from the body. Obviously, transport all these injuries with an emergency transport to the local facility, trauma care, and let them handle the problem because it's out of our scope. Rectal bleeding may present as blood or soak through the undergarments. Possible causes include sexual assault, rectal foreign bodies, hemorrhoids, colitis, and ulcers in the digestive tract. Significant rectal bleeding can occur after a hemorrhoid surgery, and it can lead to significant blood loss and shock if untreated. Sexual assault and rape are all common, unfortunately. Victims are generally women, and there's been some more men out there in the world. Depends on where you ask, but majority of it is unfortunately women. Sometimes men and children are victims too. Often there is Little that you can be done. Little there is, little more can be done just besides providing compassion and transport. The patient may have sustained multi-system trauma and need to be treated for shock. And the best thing I can tell you, this is what's going to happen on Chris Wally's truck. I can promise you. I prefer to work male-female truck. That's just a personal thing I have learned over time. If you work double female, double male, man, I think that's awesome. As long as you're happy, you're cool. I have treated multiple females in my career, unfortunately, that have been assaulted, have been beat, been raped, that just don't feel comfortable in telling a male of some of their female problems. I'm okay with that. That's why we have partners on the ambulance that are capable of also treating patients. I have multiple times placed my partner in the back of the truck and driven them smiley selves to the hospital. Be like, you're gonna have to ask my partner or my basic, whatever they are. You're gonna have to ask them a report because I didn't ride in the back with them. Well, why not? The paramedics are supposed to. Try to make the patient comfortable. It's all about this, making everything comfortable. I'm not gonna ride in the back with a female that just got, brutally raped by a male. That's not comfortable for her. She don't want to be in a locked area by myself. Cool. Do not examine the genitalia unless there's obviously bleeding. That is going to require more than one person there. You don't need to do it by yourself, so you don't get into that he said, she said shit, because you're going to end up being guilty no matter what. So, females too, don't do it by yourself. Make sure there's another co-worker, law enforcement, or somebody else that the family knows. You need to double secure yourself. Don't speculate at all. Only record the facts. Document the patient's history. Assessment right there is assessment, treatment, and response to treatments. Um, just write what's said. Don't be like, well, it assumed to be. No, no, no. Remember, if it's a crime scene, don't mess it up. Don't tell the patient, oh, go take a shower, go, do your hair. No, let them. You need to transport them, unfortunately, in the way that you find them. Uh, you don't need to touch them. If you do have gloves on, that's fine. But they need to stay in the state that you found them until they make it to the facility so that they can be treated, unfortunately, in the state that you find them. And I hate to use the word dirty, but they have potential chance for evidence on there. You need to try to insist that they stay that way. Don't use water or unfortunately anything until they get there. And we want to try to take them to a facility where they're called SANE nurses. They are certified in treatment and care and all that of sexually assaulted patients. So that's the best thing that you can do. Make sure your EMT caring for the patient is the same gender as the patient whenever possible. Like I said a while ago, treat medical injuries and provide privacy is the biggest thing that you can do, and try to reassure them that things are going to be okay. Don't ever say it's going to be fine. You use your words, choose your words appropriately, y'all, because the state of your patient is all on you and trying to calm them down and to the treatment ability that you can do. So be very cautious on your words. Guys, I know that I've made this class unfortunately semi-fast, but like I said, I have to get some things done. There is your password for the evening. It is 7-69. And I get these codes by random code, so y'all don't think I come up with them off these walls. 7-69 is also in the chat. That is your code. You listen to me, y'all. That is your class code for attendance and your test code. It is good for 5 days. After 5 days, multiple of y'all know you have to provide me with a written chapter thing by email. If it's anything up to 10 days, you lose 10 points. Anything further than that, you risk the potential of not being able to take your exam. Joanna, I love you, girl. I'm picking on y'all. It's been a little rough out here. Sometimes I know a couple of y'all have asked me to get something done. I have not been able to do it. I have not been in my office a lot. We have been extremely busy. Matter of fact, like I said, I get off tower at 6. I have to go finish doing things and getting some things done. So, y'all, I am so sorry I rushed this class tonight. Please, please, please email me, DM me. Y'all obviously know how to get in touch with me. Sometimes that I just won't answer y'all because I go to bed early out here. So, if I can help you out, y'all let me know. But it is very hard to teach some of y'all some genitalia injuries and how to treat them when we've all had them as male and females for our lives. We know these things. They ours. You handle your business. All right, folks. Y'all have any questions, concerns? I really want to hear your problems. No, I'm just picking. If y'all have any issues, y'all know. Please reach out to me. I will do my best to accommodate y'all as much as I can. I won't baby you, but I will do everything I can to help you out the best of my abilities. If y'all haven't learned, I'm very truthful. I'm very honest. I don't sugarcoat nothing. So y'all may not like some of my statements, but I'm gonna tell y'all what y'all need to hear. Listen, get that code, write it down, screenshot it, blink your eyes twice, get a mental picture, and listen. I hope y'all have a fantastic evening. Your test will not open till 8 p.m. You can submit a class roster around 8 p.m. when you go to take your test. So no questions other than that. I'm gonna mute it. I'm gonna kind of bow out, let y'all have it, and then I will finish the class off. And with y'all having a great evening. Good night, folks. Deuces.